Thank you very much, Bu Siwi. Good afternoon, everyone. It's been a pleasure for me to be here. And it's a happy topic for me because I'm an epidemiologist and social responsibility, it's out my comfort zone. So, because I was asked to discuss this, then I'm trying to come up with something that I see during the pandemic in Indonesia. So I will start with this statement that virus does not travel, but people do, and that's how the disease spread and transmit. And with the more mobility, the transmission also increase, and the cases and the number of people who are infected and died also increase. So it is common sense and also ethical things to do to slow down the pandemic by flattening the curve, and this is the global strategy for controlling the pandemic by slowing down the transmission rate. Because if we don't slow down the transmission rate, then we will have a very high cases in this very short time, and it will collapse not only the health system but other system in every countries. So that's why we do different type of intervention, and particularly social distancing. But then when we slow down the infection rate, because naturally a disease will stop spreading when a herd immunity achieved. So when we slow down the transmission rate, we will prolong the pandemic. And that's hopefully we can find vaccine as soon as possible, so that we can achieve the herd immunity without prolonging the pandemic. And that's really something I don't know, but we still need around 1 or 2 years to come up with those vaccines. So there is this dilemma. I call it deadly dilemma. On the one hand, when we have usual mobility without any social distancing intervention, we will have more COVID-19 cases and also higher death rate. But if we stop the mobility, we also have a risk of increasing death due to non-COVID cause. For example, this is in India. I quoted from BMG that the quote is that people who need chronic cares, they cannot go to the health facility because lack of access. And on the other hand, when they did the lockdown, the picture here showing that it even amplify the transmission, because then people want to go home. And this is the queues, a huge crowd of people who try to go home before the lockdown emphasized. And another thing is that if we look this is a modeling simulation conducted by Hopkins, try to estimate or simulate what is the effect of COVID-19 to the maternal and child mortality. And if we see here, they have different scenario, but the third scenario is the worst. When they have majority, this is on the right table is the scenario. And mostly the difference is being the access to the healthcare services. So in the first scenario, it's only small, moderate, and high access. And then it reduces the coverage of the intervention. And And when they simulate the model, they found that within 12 months of those extreme social distancing, it might create higher mortality cases rather than the COVID-19 fatalities. So, for example, here in the first scenario, there is a 2.3 something million children die, and also mothers on the upper rows, it's a higher mortality. So that's the dilemma, and this is only in the maternal and child health. And as I mentioned before, there are chronic cases which need also access to the healthcare. So there is this two dilemma. If we stop, we prevent the transmission of the virus, we prevent COVID-related death, but we create or enhance death due to other causes, but related to our intervention. And that's something we need to find a way to minimize both. So the challenge is how to find a balance between reducing the transmission and cases and also fatality of COVID, but also the least death because of others causes, but related to our intervention to COVID. Another aspect is that human is social beings, and this is a Japanese proverb, mangan ora mangan kumpul, and it's in English translated more or less. Being together is more important than being fully fed. So social gathering is really our DNA. And even we say that it's better we gather together rather than we fully fed or we have money to have a good life. And when the COVID comes, it somewhat tear down the social fabric of society. And it's really hampering every activities in the society to maintain this social cohesion. So the million-dollar questions, I think, for us is that because it is inevitable that we need to adjust to the situation because we will live with the COVID perhaps 3 or 4 more years, or even more if we cannot find the vaccine. So what are the appropriate new normal for the society, taking into account those things? And what are the challenges to adopt that? And that's part of the social responsibility, I think, that we need to also think about that. So I'm trying to see this at the different level. There are a new normal for the government level, for the business sector level, for the society level, and at the individual level. In each, there are different things that we need to adapt in terms of new normal. For example, for the government, because this is very new, we never have experience with this within our Indonesia countries, government. So there's a lot of adaptation that we need to change in the government. For example, we need to reorient national priorities, strengthen social safety net system, clear control policies and risk communication. This is something that we don't really good at it. And also trust building, and something also I see that government is still failed to do that. The trust building within country, that this is our common enemy, and this is not about us and you, because this is something that nowadays in practical and in political arena, everything should always perceive as this is us and you, whether it's our interest or your interest. And that's something hampering our effectiveness of controlling the pandemic. Another one at the business sector, of course, through different intervention, we need to find a way of doing business with less mobility and less contact. And in the society, as I mentioned, that our culture is really try to gather, and that's facilitate transmission. So that we need to adapt with our new values, because we never differentiate between social connectedness and with physical connectedness. We never differentiate that. Perhaps it's time that we still can be connected socially, culturally, but not necessarily connected physically. But then also we need to strengthen our social capital and social cohesion, because traditionally we do it by gathering together, and when we cannot do it in our normal way of business, then we need to find a way to strengthen the social capital. And I think the example of Prof. Rimawan is a very excellent example of doing innovating how to strengthen social capital and social cohesion through community movement. And at the individual level, I think Prof. Laksono mentioned that we never have a concept of risk. But now I think it's time we introduce that it's the individual who has the risk. It's the individual who are the risk bearer, not someone else. So if you don't do what you call infection prevention, then you will have a greater risk of getting COVID-19. So what are the challenges? There are several challenges. This is not mutually exclusive, but some that I observe. It might be more than this. One is the incoherence information, a big uncertainty, inconsistency in implementation of pandemic control, and I see currently people think, the stakeholders thinks pandemic control as a political contest during the election. So people try to be very popular and gain and capitalize that popularity. So there are several examples of incoherent information. One is infodemic, and this is really also WHO addressed this, that infodemic is more severe than the real pandemic. And we have a lot of information, be it true, fake, half fake, which make people desperate and paralyzed to make a good judgment and a good decision. Another thing is this poor risk communication strategy. From the beginning, the government is not have a clear communication strategy, risk communication strategy, and it create distrust within the community, and it's amplified with the distrust which already happened because of the political tension from previous election. Another thing is the media literacy. With the rise of social media, media try to catch up by using more clickbait titles. They don't really care about the accuracy, but they want to go into click, and that's also creating a chunk of information. And that's, as a consequence, there are a lot of stigma around it. And it's not only in the lay people, but even in the healthcare workers. I consulted a lot of healthcare workers afraid of being tested because of the stigma from the community. There are also a big uncertainty in economy, which create another also uncertainty because of social disconnection. The longer it takes, the more psychological fatigue it gets. And Also, the inconsistency of pandemic control implementation also create a big distrust. This is, I think, one of the popular movement, Indonesia whatever, because people who break the law, they get nothing. And those who are following the law, they just feel helpless because it doesn't make sense for those sacrifices. And I already mentioned this, the people try to capitalize the situation. And there are more competition rather collaboration. And that's, I will end with this. There is no best policy option for countering pandemic because we have this policy dilemma. And everybody needs to adapt and contribute to be able to control the pandemic, and adaptation challenges might hamper the pandemic control efforts. Thank you very much.